discharge papers and they don't know what all of it means. So a lot of times they bring that to their primary care doctor and they're like, okay, I want you to explain it to me in a lot simpler terms so I know what's going on.
Yeah. Yeah, it can definitely be confusing. So the primary care, I like to kind of think of them as almost being like the quarterback or the conductor for individuals' healthcare
Ooh, that's good.
because you kind of help run the whole team for the individual. So, especially people as they go through life and you start to have multiple medical conditions going on, possibly affecting different body parts, as the primary care physician, you're the one who is going to coordinate with their cardiologist and the nephrologist or the kidney doctor to make sure that the medications they're on aren't going to have side effects with each other and that everything is going to be managed properly. So even though you're not necessarily the one that manages all of those conditions specifically, you make sure that everything is managed in unison so
Mm-hmm.
that the patient is getting the best possible care.
Yeah, that's a good analogy. Something else I liked about Family Med is just the variety of patients. I loved it because I thought it made the days go really fast. So you could see a newborn baby, and then you could see a 50-year-old woman, and then you could see a 13-year-old, and then an 89-year-old. And it just made the day go a lot faster because you were constantly seeing totally different patients.
Yeah, the variety is definitely one of the perks.
One of the other things I liked was the work-life balance. The hours were not bad at all. It was like 4 days a week, 7 to 4, and no weekends.
Yeah, knowing when you're going to be at work is a fairly rare thing in the medical field.
Yeah.
And another plus with the hours and work life balance in family medicine, this obviously varies depending on what practice you're part of or where you work.
Mm-hmm.
But usually, family medicine doctors still are technically on call, but they're truly on call as opposed to other specialties where if something happens and they call you, you might have to go in. For family medicine, it's usually you're the one whose number gets forwarded to patients if they have a concern in the middle of the night. They call you, you can give them advice on what to do to manage it, or you can advise them to go to the emergency room if it's something that's actually an emergency and is an acute issue, or you tell them, okay, I'll have you come in and see me tomorrow morning.
Yeah.
But it's not something where you have to get up, drive into the clinic or hospital in the middle of the night to see people.
No. And most of the time, at least in the places that we've worked or been students, the call was super laid back compared to other specialties. Like it was
Yeah,
only a couple days a month, not like some of the surgical specialties where you're on call a
like a
big chunk
week.
of the
Yeah.
time. So that's the stuff I liked. The only thing that I really, at least, I really, I don't know if I disliked it, but it was just frustrating to me about Family Med is that when patients were non-compliant with medications, and medications or lifestyle changes, or just not really open to talking about their medical issues, that was something that was frustrating to me. Obviously, it's bound to happen, and there's a lot of factors that, as a physician, maybe you don't know about the patient, especially if they haven't opened up to you yet. But that was something that was frustrating to me. I was like, how have your lab values gotten so wacky? Like, are you not taking your meds? And then they would not be, and they would be lying about it. And I don't know. That was the thing that was probably the most frustrating to me. And it did not happen a lot.
Yeah. I feel like as a family medicine physician or in primary care, that's where you really notice the socioeconomic issues that could be affecting your patients and you kind of see that front line. I feel like when you're actually treating patients in the hospital, you're always kind of sheltered from that because usually once they're admitted, their insurance is like approved, on board, whatever, you do what you need to, but then you don't necessarily see them outside of that. But as a family medicine physician, you're going to know if the treatment regimen you have them on is too confusing or if they can't afford their medications because you're the
Mm-hmm.
one that sees them most frequently.
Yeah, exactly. So that was something that was just a little bit frustrating. But honestly, I don't have any other things that I really disliked about it. I loved my family medicine rotation, and I learned so much.
Yeah, I don't necessarily have anything I disliked. I would say there are a few things that weren't just like quite the good fit or exactly what I was looking for. I've never really loved managing medications all that much. Pharmacy and the different drugs and everything just never really came easy to me. So then when you're seeing patients and trying to make sure that you're getting them on the right doses, right schedule, no side effects, no complications, that wasn't something I was really looking for in terms of doing on a day-to-day basis in my career. And then the other one was managing chronic diseases, which obviously has become a huge issue in our country and is something that's going to continue to be an issue, that just wasn't exactly what I was looking for in terms of my day to day.
Mm-hmm. Any other things about family med you want to chat about?
Why don't you tell us what the most common conditions were that you saw, which I know you touched on a
Okay.
little bit, and then maybe the most interesting thing that you saw in your family medicine rotation.
Ooh, I'll have to think about that one. The most common stuff that I saw in my family med rotation was a lot of chronic disease checks. So, like checking high blood pressure, diabetes, managing meds. That was probably the most common stuff, I guess, that we saw. We also saw a lot, the provider I was with saw a lot of kids too. So, we got to see a lot of kids and do just well child checks, which I always thought were fun. And then the most interesting thing, hmm, we had a patient that came in who was a little bit younger and he had crazy hypertension. And we couldn't figure out what was causing it, but we eventually did, and it was renal artery stenosis. So that was cool to get down to the root of what was causing this person's hypertension.
So could you guys actually hear, like when you listened, could you hear the like whooshing or whatever, I'm blanking on the term for
Brewy.
it, the bruy?
The bruies. Yeah,
Yeah,
we could hear the bruies.
that's cool.
What was the most interesting case that you saw in family med?
I guess the most interesting that we had a patient that came in that we found had a melanoma on their
Oh,
back. So
interesting.
nothing like crazy, like rare or like out of this world unique, but it was just neat to see something I hadn't seen anywhere else, and that we were actually the ones that diagnosed it for the first time when we were there, or at
Yeah.
least we didn't technically diagnose it, but we were highly suspicious of it, and we referred them to get a biopsy, and it ended up being melanoma.
Yeah. That's another one of the cool things about family med is that you are the front line. Like you are this patient's early detection system. So every time you do a physical exam, you are going to be the first person that's going to catch something if there's ever a problem going on. Um, but I think that's all that we have for family med. That's just a little picture into what it's like to be a family med student.
Yeah, and I think a little bit about what family medicine physicians do in general. So when you think of a doctor or what a doctor does, usually the description you'd give is that of a family medicine physician.
Yes, definitely. Great specialty,
Lots of flexibility
good work life balance.
and very, very in demand.
Yes, very much so, just like any other primary care.
All right, guys. Thanks for listening in again.
Thank you. And if you have any suggestions for future episodes, please get in touch with us at medicinemade.easy podcast@gmail.com, or you can find us out on Instagram. We're posting some spiffy new pictures.
All right. Thanks, guys.